Now, now shifting over towards health reform and related issues. Now, one of the things that you said to me was this is actually, in some ways, a remarkable time for mental health and substance abuse policy, and that we've made a lot of gains that people might not appreciate. Uh, why don't we talk a little bit about that? Maybe we should start with the pre-story to health reform and some of the legislation that that was passed before the Affordable Care Act. And were you involved in some of that?
Yeah, I was involved in the fight for what is just shorthanded as parity, but the full name of, which I hope I can get this right, the Paul Wellstone, PeteDomenici Mental Health and Addiction Equity Act, I think was the actual final title of the law. But that was a 12-year fight from 1996 until 2008 to require large group insurers, in other words, companies that had at least 50 or more employees, to have any benefits they offered for addiction and mental health be comparable to the benefits they offered for other disorders, which they were not required to do. So in other words, it was legal to say, our plan has a copay of $10 for all outpatient visits, except mental health and addiction, and that's $25. Or you get this many days of inpatient care, unless it's mental health or addiction, in which case you get half as much. So, that was a 12-year fight, and, the mental health community and the sort of addiction, recovering community in the addiction field did a tremendous job of just, going year after year, day after day, month after month, up to Congress and making the argument, this is an illness like the other illnesses. It needs to be covered like those illnesses. And it was a long slog, to quote Don Rumsfeld, my non-friend Don Rumsfeld. But it was a long slog, but the precious thing about it was, that bill took 12 years to become a law and was far more modest than what happened in the ACA in terms of its effect. But it laid the groundwork in the Congress for what happened in the Affordable Care Act. Because when those same advocates, or people like me, came up and said, how about we have the Affordable Care Act cover mental health and addiction at parity, the reaction on the Hill was, oh, parity, right, we already voted for that, right? Yeah, sure, fine. We'll do that again, no big deal.
Now,
Big deal.
can we, before we move on, what were some of the shortcomings in that bill when it was finally passed that needed to be addressed in health reform?
Yeah, well, there were a couple things. One is, parity only applied if you had insurance from an employer, a large employer. Now, that's over 100 million people. That's important. That does nothing for people with no insurance. Second, there was a compromise at the very end. It was a very near thing getting parity done because it was the very end of the Bush administration. And it was, oddly enough, parity was actually folded into the TARP legislation because they were trying to get extra votes for TARP. And I think my friend, I have to check this thing, but I think my friend Jim Ramstad, who was in the Congress and one of the lead sponsors, they knew he wanted parity so bad, I think they might have put it in TARP to get his vote because he had voted against TARP initially. I'm not sure, I'll have to check that with Jim today. But anyway, so there's great pressure, and the problem was the Senate bill and the House bill were different. So the Senate bill was more, it said, if you choose to offer these benefits, they must be comparable. And the House bill said, you must offer these benefits, and they must be comparable. So even after parity passed in the Senate rule, a company could say, we're just not going to offer mental health benefits, period. And that would still be legal. And it was a tough decision for everybody. Had to bite the bullet. It would have been a big gamble to say, well, let's go to conference and see what happens, because this is November. What could happen is nothing. And so it was agreed to take the Senate bill, but there was a great sense of wanting to complete the unfinished business of actually making the benefits themselves mandatory, and that is in the Affordable Care Act. So when the Affordable Care Act, if you look at the language, it says not just that if you offer these benefits, it has to be the same way you would cover anything else, but it uses the language, as you know, essential health benefit. And it says, substance use disorder is an essential part of your benefit. So all the plans in the health exchanges, the Medicaid exchange, and any new insurance plans have to cover it at parity. So that's how it was sort of a 1-2 punch of parity and then ACA. And together that's, something like HHS ASPE office says, about 62.5 million people would benefit in terms of ACA. You had over 100 million on parity. That's a lot of people getting, either going from no coverage to some coverage or some coverage to better coverage.
Just to go back to that for a minute. So 62 million Americans are going to get mental health and substance abuse service coverage that they didn't have before health reform.
Yeah, 62.5 million is a sum of two numbers, which is basically people who had no insurance who got insurance that covered mental health and substance abuse.
Mm-hmm.
But it also covers those people who had that, but they didn't have it at parity. So it's both people who went from sort of being a bit underinsured to getting decent insurance, and non-insured to getting some insurance.
Gotcha.
And that number comes from the Sherry Gleed's office, which is the Assistant Secretary for Policy and Evaluation at HHS.
They're planning an evaluation, but I think, but
I'm sorry, explain that. My mistake. Yeah.
But it's so this is from my point of view as a public health researcher doing some similar work to what you do. This is really pretty fundamental, because just to give people a sense of things, in 2012, a lot of people ask, how poor do you have to be on Medicaid? And the answer to that in 41 states or so is actually you could have an income of $0 and not be eligible for Medicaid. If you're not a mom, you don't have AIDS, you don't have a federally recognized disability, and substance use disorders are not federally recognized disabilities to get on assistance programs. So if you think about who is the typical person, let's suppose that you encounter a beggar on the street in Chicago who asks you for some money, and you think maybe this person has a substance use or mental health issue, and you think this person should really get treatment. Then you stop and say, well, wait a minute, who's going to pay for that treatment? Mm-hmm. And the answer right now is, well, nobody quite knows. It depends. There's a patchwork of programs that people haven't heard of. There's a block grant that goes from the federal government to the states. The Substance Abuse Prevention and Treatment Block Grant will cover some of that. Mm-hmm. There's some people could go to a federally qualified health center and get some services that they would need. But basically, your typical single male adult with a substance use or mental health problem is exactly the person who's going to be uninsured, or certainly the person who would be underinsured if they were lucky enough to have insurance in terms of these critical services. So the fact that, what you were just describing, particularly the fact that Medicaid will cover these services, is basically taking this huge chunk of people who right now have very limited access to the safety net and impose huge burdens on cities and counties and all the people, all the systems that have to try to take care of them, and it's going to bring these people access to Medicaid and cover these services. And so that is really an enormous change that, from my point of view, is one of the really important things about health reform that most Americans don't know about. Have I gotten anything wrong in that?
I think that's very well said, Harold. And of course, as you and I both know, that's a population with a higher than average prevalence of both substance use and mental health disorders. So it couldn't be better targeted as a new benefit. And we also ought to mention too, that the other change, which started in 2008, but is taking an effect really this year, is the Medicare change. So when Medicare was founded, it had also a discriminatory structure built in. For outpatient care, Medicare covers 80% of everything except mental health and substance use, which it only covers half. And that's a massive copay, 50%, and it has really made Medicare a much smaller player than you would think it would be in the mental health and substance abuse arena. So the 2008 Medicare, the MIPA bill, the improvement bill, had in it a provision to get rid of that, which I believe, if I remember right, came out of Pete Stark's office. I'm pretty sure he was
there. Now, why was it so discriminatory in Medicare? Do you know why it was set up that way?
It probably had to do with the stigma of these conditions at the time. I mean, and also these are very weak constituencies. I mean, who really? I mean, there's people like Ted Kennedy, God bless him, who really passionately identified, cared with seriously mentally ill people. But most people don't. Most people are scared of them. Most people don't want to stand up for them. So, and you're trying to, I assume, like all Congresses, they were trying to think, how much does this cost? How do we limit things? And said, well, let's cut the mental health and substance abuse. Or maybe someone said, we're going to be paying for psychoanalysis for all these people. We don't want to pay for that. I don't know how it came about, but I'm just sort of betting because those have been the generic processes that have tended to underfund care for those two populations. So just say what the change is, so people know, is that so this year it took a long time to phase in. Again, I assume that had to do with the 5-year budget projections. But this year, we're talking in 2013, the copay drops to $35, and then January 1st it drops down to $20. In other words, just like the rest of Medicare. That's really big. I think there's 50 million people on Medicare. Is that the current number? Yeah, and of course, growing exponentially as the boomers age.